Hello, all, and welcome. I am Dr. Joanne Yanez, the Executive Director for the Association of Accredited Naturopathic Medical Colleges. And today we are going to be talking about nourishing your mental well-being with Dr. Aucoin. So just a little bit of housekeeping before we begin. Everyone here is in listen-only mode. And so if you do have any questions during the course of today's webinar, we ask that you use the Q&A function for any questions that you may have so that we can track that best. This forum is being recorded, and we will share that link later in the week when that is ready. If you have any questions or incur any difficulties, please feel free to email us, as always, at info@aanmc.org. You'll see that there's a little poll that is launching right now. Feel free to answer those questions so we know a little bit more about you. And so with us today, we have Dr. Monique Aucoin, who is a doctor of naturopathic medicine from the Canadian College of Naturopathic Medicine, holds a master's of science from the University of Guelph, and is adjunct professor at the university in the Department of Health and Human Health and Nutritional Sciences. She is a senior research fellow at the Canadian College, and we are really excited for her to present some new research and groundbreaking research on the connection between nutrition and mental health. And so with that, I'm going to go away. I'll be here in the background and turn it over to you. Thank you so much for joining us today.
My pleasure. Thank you so much for that introduction. The title of my talk today is The Role of Nutrition in Mental Health, Findings from Newly Published Clinical Trials. So just to start off with some disclosures, I have no conflicts of interest relevant to this presentation. The funding for the EASE-GAD study, which I'm going to be presented today, the funding is listed on this slide, although the funders had no role in the design, conduct, or analysis. Okay, so let's start off talking a little bit about mental health and mental illness. We know that many people are affected by mood and anxiety disorders. About 5% of people within Canada and the United States experience major depressive disorder or an anxiety disorder in any given year. The symptoms of depression include things like feeling sad or hopeless, as well as changes in behavior, energy, irritability, sleep changes, or loss of interest in previous things that someone enjoyed. The symptoms of generalized anxiety disorder include worry about everyday things, as well as a number of physical symptoms. We know that there are a number of causes for mood and anxiety disorders that have been identified, although I think there's still a long way to go in terms of fully understanding these conditions. Many of these risk factors are not able to be changed. So things like genetic factors, stressful life events, particularly early life experiences, we can't modify those factors for people. The second last bullet here, dysregulation of neurotransmitters. This is the focus of a lot of the medical approach to treating mood and anxiety disorders. There's this understanding that imbalances of neurotransmitters, either too high or too low levels of certain neurotransmitters, plays a role in the development of these conditions. So medications that are used to modify levels of neurotransmitters. However, there are newer hypotheses and newer understandings emerging in the last decade or so about how other factors beyond life experiences and neurotransmitters might be playing a role in the development of mood and anxiety disorders. Things like inflammation, oxidative stress, gut microbiome imbalances. And some of these mechanisms are very interesting because they interconnect quite a bit with diet and lifestyle. And we're going to talk about those as we go through the presentation today. So we know that in the treatment of mood and anxiety disorders, the main treatment options that are available are psychiatric medications or psychotherapy. And many people do benefit from these treatment approaches. However, there are limitations. Some people experience side effects. Others experience barriers to access, things like costs or wait lists or availability of healthcare practitioners. As well, not everyone finds these treatments effective. There are many who try these therapies and don't find a benefit, and there can be stigma in pursuing these treatment approaches. So as a result, there is quite a high rate of untreated mood and anxiety disorders. Generalized anxiety disorder, which is the focus of my research, we know that about it's only about 20 to 32% of people with generalized anxiety disorder who receive appropriate and effective care for their condition. So as a result, this means that many people are living with inadequately treated anxiety disorders. And this really highlights the need for novel approaches to treatment, add-ons, or additional ways that we can support people experiencing these conditions. So let's talk a little bit about nutrition. Beginning with some of the observational evidence. So observational evidence is when researchers look at what people are doing without changing any of their behavior, but look at what they're doing and look for associations between certain lifestyle factors and certain health conditions. So these are just two examples of cross-sectional studies about the relationship between diet and mental health. In the first one, we see a strong positive dose-response relationship between healthy diet and higher emotional scores. So in this case, these adolescents, the adolescents who had the higher quality diet also had higher emotional scores, less depression symptoms. Here's another cross-sectional study. People with the eating more Western style diet had higher rates of anxiety symptoms. The challenge with cross-sectional studies, though, is that you're measuring both diet and mental health at the same time point, and we're not able to tell which came first. We know that mood and anxiety disorders can have an effect on people's motivation or their access to accessing food. So it's possible that having a mental health condition might influence diet habits. But as a researcher, I'm really curious about how does diet habit impact mental health? So the good news is there are research study designs that can help us to differentiate between those two directions. So here's a prospective observational study. What this means is that they recruited 1,500 participants who were healthy at the beginning of the study. They assessed their diet quality, and then they followed them over 10 years. And the people who had the highest diet quality at the beginning of the study had a 60% lower risk of developing depression over the course of the study. So on this graph, we have along the bottom the average healthy eating index. So from a low quality diet to a very high quality diet. And here along the y-axis, we have their risk of developing depression. As we can see, the people with the lowest quality diet had the highest risk of developing depression during that 10-year follow-up period. Whereas as we look at people with higher quality diet, their risk of developing depression in that follow-up period decreased. And I think it's really important to note that there is this plateauing effect. Sometimes people think that they need to aim for this perfect diet. And I think this graph is a really nice illustration that the difference between a low quality diet and a moderate to good quality diet is actually very dramatic. But good to perfect is probably not that meaningful of a difference. But anyways, the point of that slide is that we have this evidence that better quality diet seems to have a protective effect. When people are eating a higher quality diet, it seems to decrease their risk of developing depression over time. But as a healthcare provider, I'm interested in prevention, but I'm also really curious about treatment. In order to understand the effect of diet as a treatment, we want to look at what's called experimental evidence. This is where the researchers are giving some sort of intervention. They're making a change and monitoring what is the impact of that change. So this is called the SMILE study. It was the first of its kind in this field, and it provided really exciting evidence about the effects of dietary counseling for depression. So what these researchers did is they recruited adults who had moderate to severe depression. They also had a low baseline diet quality. And the researchers randomized them. So they assigned them to two groups randomly. One group was the control group, which got social support. So the people were meeting in a group and interacting socially. The other group was given the intervention. This was the Mediterranean diet. It involved personalized dietary advice, motivational interviewing, and it consisted of 7 sessions over 12 weeks. They met one-on-one with a dietitian to receive this treatment. And here's what they found. In the social support group, from baseline, the dark bar, to 3 months, the lighter gray bar, there was an 8% reduction in their depression symptom severity. Social support does have a benefit when we're talking about depression. But here, when we look at the Mediterranean diet group, we see a 32% reduction, a much larger decrease in depression severity among those participants receiving the Mediterranean diet intervention. The number needed to treat was 4, which is kind of a technical research term. But what that means is that at the end of the study, one out of every 4 participants who started off with moderate to severe depression, at the end, 1 in 4 no longer met criteria for having depression. So about a quarter of the people achieved remission from their major depressive disorder, which is really exciting. This study also included a cost analysis where they measured the cost of the food that people were eating beforehand and during the study. And they found that there was a decrease in the food cost compared to baseline. And this had a lot to do with eating less processed and packaged food, choosing things like plant-based proteins over meat options for some of their meals, cooking more at home, and using things like canned and frozen foods. Okay, so moving on. So that was the SMILE study. The next study that I'm going to talk about is called HealthyMed. This is a study where they recruited 153 adults who had diagnosed or self-reported depression for at least 2 months that was moderate to severe in nature. They randomized them, again, to nutrition or social support that lasted 3 months. And in the nutrition group, they got fish oil, nutrition education sessions with a dietitian, cooking workshops, and a food hamper. And they assessed them at baseline, 3 months, and 6 months. And here's what they found. When we look at the Mediterranean diet score, there was a small increase among the social support folks, but a much larger increase in the people receiving the Mediterranean diet intervention. When we look at depression scores, we see a decrease in the social support group, but a larger decrease among those receiving the Mediterranean diet. And when they looked at the 6 months follow-up time point, the people were receiving the treatment from baseline to 3 months, and that's where we see the decreases in depression symptoms. But we see that those improvements were maintained from 3 to 6 months. The participants were not receiving any intervention during that time, but they were able to continue that progress on their own, which is really exciting to see. And then the last depression study that I'm going to highlight is called the AMEND study. This came out in 2022, so one of the more recent ones. And this was a randomized controlled trial that recruited men who were 18 to 25 years of age. This is really important because young men are a demographic who often doesn't access mental health care. These are often folks that are untreated. And so it was exciting to test out this intervention among people who are generally not accessing care for their condition. So again, they did 12 weeks of either Mediterranean diet or befriending, that sort of social support component. And here in this figure, we can see the change in depression score for the group receiving the Mediterranean diet went from 34 to 14. So again, we saw this large reduction in the severity of depression symptoms in response to the Mediterranean diet. So I've shown you a few examples, and there's actually even a couple more of clinical trials that assess the effect of diet change for depression. But up until recently, there weren't any studies that had looked at anxiety. They had all focused on depression. But that's where my most recent study comes into the picture. So the name of the study was EASE-GAD, which stands for Eating and Supplementation for Generalized Anxiety Disorder. This was a pilot study, and it was randomized and waitlist controlled, which means that we randomly assign people to either complete the program right away or to do a wait list and then complete the program. And we compared what was the impact of the people doing the treatment right away compared to being on the wait list. And we recruited 50 adult women with moderate to severe generalized anxiety disorder. The intervention that we provided was dietary counseling. So similar to those previous studies, it was 7 sessions over 12 weeks, and it was based on the Mediterranean diet. It also included things like goal setting and action planning. We provided recipes, videos, and handouts, and we included an omega-3 supplement, which was a high-dose, high EPA formula. And here's what we found. So in terms of diet quality, among the people on the wait list, there was really no change in their diet quality from baseline, the green, to 12 weeks, the turquoise. But in the people receiving the intervention, there was a significant increase in the diet quality from baseline to the end of the intervention. And then when we look at their anxiety symptom severity, among the people on the wait list, we see a small decrease in anxiety symptoms. But among the people in the intervention group, we saw a much larger decrease. So the average anxiety symptom score went from 26 to 11 from the beginning to the end of the intervention among those people who did the program right away. So this was really encouraging and exciting finding. So let's talk a little bit about what it was that we had asked people to do. So this is one of the handouts that we provided to the participants. We gave them some goals related to protein, fat, vegetables and fruit, and carbohydrates. We asked them to include protein throughout the day, to eat more legumes, fish, and seafood. We asked them to use olive oil as their main source of added fat and to eat nuts and seeds on a daily basis. We asked them to include vegetables with each meal and 2 servings of fruit per day. And we asked them to choose complex carbs instead of simple ones and to drink water as their main beverage. So let's talk a little bit about why we gave them these recommendations and how these certain foods might impact mental health. So starting off with choosing complex carbs. Well, this is important because of the way your brain deals with carbohydrates. Your brain can't make or store sugar, but it uses sugar as its fuel. This is really, really important to the brain. So it relies on blood sugar. That's the sugar that's available in the bloodstream and made available to the brain for energy. The symptoms of hypoglycemia or low blood sugar overlap quite significantly with the symptoms of anxiety and depression. Has anybody heard the term hangry? That's one that's used often to describe that feeling of low blood sugar causing emotional symptoms. So when we have a meal that's higher glycemic index, we see this big rise in blood sugar levels, and higher glycemic index meaning high in simpler sugars that convert more quickly to blood sugar. We see this dramatic rise in blood sugar levels and then a decrease compared to a lower glycemic index where we don't get as big a rise, but we also don't get as sharp a drop off in blood sugar levels. So what we want to avoid is this reactive hypoglycemia, where in response to a big increase in blood sugar, we get a big decrease and people feel really not their best at this time point. And when people experience anxiety disorders, those symptoms of low blood sugar, things like feeling shaky, their stomach feeling off, feeling irritable or on edge, those symptoms feel very similar to anxiety symptoms. And for people who are prone to anxiety, those hypoglycemia symptoms can aggravate their anxiety symptoms. So here's a really great example of this that for me was one of the reasons why I got into this field of research. So this is a case from my clinical practice dating back to 2016. It was a 15-year-old girl who was diagnosed with generalized anxiety disorder, and she also had hypoglycemia symptoms. When I first spoke to her, she was eating fruit, juice, bagels, white rice, vegetables, uh, granola bars, cookies, gummy candies, white pasta, and toast. That's what she reported eating in a day. So it was very clear that she was eating this diet very focused on simple or refined carbohydrates. So as a treatment, I asked her to add some protein and some fiber. And sure enough, her anxiety severity decreased from what she rated as an 8 out of 10 to a 4 out of 10. And during a period where she briefly returned to her previous diet, she noticed a worsening in her symptoms. So I thought this was, a great illustration of the impact of diet and blood sugar on anxiety disorders. But when I went and looked at the scientific literature, there was almost nothing in the scientific literature about this connection. So I published a case report because I thought, wow, this is really relevant and important and people should be talking more about it. And this helped to create the justification for that EASE-GAD study that I did. Case reports are a really exciting way that naturopathic doctors can participate in research, even if research isn't their main thing. But it helps to identify things that are important and things that warrant further study. All right, so here's a little bit more about complex carbohydrates. Beyond impacting blood sugar, complex carbohydrates are important because of their impact on the microbiome. Complex carbohydrates are a source of fiber, and fiber are those carbohydrates that we can't digest for fuel, but they feed the bacteria in our gut, our microbiome. Diets rich in fiber create more diverse and healthier gut microbiomes and increase the production of all sorts of molecules that are important for supporting mental health. And when I talk about this, as soon as I mention the word microbiome, one of the first things that people say is, "Oh, is she talking about probiotics?" And I want to really emphasize that diet is actually a really, really important factor when we're talking about microbiome health. So here's a really neat study that I think illustrates this really well. So somebody came up with this very creative idea to do a study where they did a 2-week diet switch. They recruited African Americans, so people living in the United States, and they fed them a traditional African diet, which is high fiber and low in fat. And then they recruited rural Africans, people in Africa, and fed them a Western style diet. So things that the Americans would have been normally eating. So this is high fat and low in fiber. And within just that 2 weeks, the researchers found a remarkable change in the microbiome. There were dramatic decreases in the production of different molecules that are really important for health generally, as well as mental health. So the purpose of the study is just to emphasize that when we're talking about the health of the microbiome, it's not all about probiotics. The food that we eat influences the health of our microbiome and can make really dramatic changes. Okay, so moving on to healthy fats. All right, so this first diagram here, this mostly black one, shows us the structure of a neuron. These are the nerve cells that make up our brain and our nervous system. And within the walls of the nerve cells, there's a large proportion of fat. This is where many fatty acids, there's a large proportion of fatty acids in this area. And the type of dietary fat that we consume influences the type of fatty acids that are present in our nerve cells, which influences the structure and functioning of our nerve cells, including our brain. The type of fats that we're eating also influence inflammation. So in this figure here, we see omega-3s and omega-6s. These are fatty acids, and through their metabolic pathways, they're involved in making a number of molecules that influence the action of the immune system. The green ones are ones that are anti-inflammatory, whereas the red ones are pro-inflammatory. So we see here that consuming a diet with more omega-3s results in the production of more anti-inflammatory molecules. These are called cytokines. And this is really important because that ratio of omega-3 to omega-6 has changed really dramatically over time. The historic human diet was a ratio of about 1 to 2 omega-3 to omega-6. Does anyone want to take a guess at what this missing number here is, that ratio of omega-3 to omega-6 in the modern diet? If you want to type it into the chat, one of the moderators can shout it out. And this is if you're listening live, feel free to add this into the chat.
We've got 1 to 36.
Okay, 6 and 30 are our guesses. Yeah, any others?
20.
20?
No
Great.
using Google.
Yeah, no cheating. So it's about 1 to 15. So this is a dramatic change in that ratio of omega-3 to omega-6. So we're getting a lot more of those pro-inflammatory omega-6s and a lot less of those anti-inflammatory omega-3s. For reference, the sources of omega-3s are things like fish, flax, walnut, hemp, and chia, and omega-6 are those plant oils. And oftentimes people say, "Oh, I don't have those oils in my house," but these are used very frequently in things like processed and restaurant foods. So these are inexpensive oils that food manufacturers and restaurants are adding to their food products. So why is this important? Why would an imbalance of omega-3 and 6 and an imbalance in inflammation be relevant? This was an article that was published just 10 years ago. It's very recent that this has been brought forward as being important in mental health. But this was a statement from the Journal of the American Medical Association. Psychiatric and neurodevelopmental disorders are being thought of more and more as systemic illnesses in which inflammation is involved. We know that people with depression have higher levels of inflammation, and there's early evidence that anti-inflammatory medications can decrease depression and anxiety symptoms. And we even have a mechanism that's been proposed. When we talk about serotonin, one of those neurotransmitters that's very involved in mood and in positive mood and decreasing anxiety, well, we want to think about where does it come from? So it's made from an amino acid called tryptophan. However, in the presence of immune activation or chronic inflammation, we see that another enzyme is activated, and rather than using tryptophan to make serotonin, the body uses tryptophan to make other products that are actually neurotoxic. So not only are we making less serotonin that's important for regulating mood, we're making these other substances that are actually harmful. So this is one of the mechanisms that's been proposed for how inflammation impacts mental health. And here's just one more observational study. So this is another prospective study that involved, again, a large sample size, 12,000 people. They recruited these 12,000 people, assessed their diet, and followed them over time to see who developed depression. The people with the highest inflammatory diet had a 41% increased risk of developing depression. The inflammatory diet pattern included a high intake of things like sweetened soft drinks, refined grains, red meat, diet soft drinks, and margarine, and was low in things like olive oil, leafy greens, yellow vegetables, coffee, and wine. Often when I'm giving this lecture, somebody gives out a little happy exclamation about the coffee or the wine, that those made the anti-inflammatory diet pattern list. But again, just another example of how dietary factors impact inflammation and how that impacts depression risk. Okay, so moving on, now talk about vegetables and fruit. So vegetables and fruit are a source of fiber, phytonutrients, vitamins, and minerals. Fiber, as we said, feeds that microbiome and promotes balanced blood sugar. Phytonutrients are anti-inflammatory, and vitamins and minerals are cofactors in neurotransmitter synthesis. So I'll show you an example of this. This is a very complicated pathway that you don't have to understand in any level of detail, except for that this pathway is used to make neurotransmitters, so things like serotonin, dopamine, that are important for mental health. And part of this synthesis pathway involves things like folic acid and B12. And where do we get folic acid? Green leafy vegetables. Where do we get B12? Protein sources. So the point here is that we can't make neurotransmitters if we don't have adequate amounts of these vitamins and minerals. Okay, protein-rich foods. Protein-rich foods break down into amino acids. I have little kids, so the analogy that I always use is Lego. My kids are really into Lego. If you were to imagine the different individual Lego blocks, those are the amino acids, and then the structure made out of them, the Lego structure is the protein. In your body, your body's going to take that protein and break it down into those individual amino acids, the Lego blocks, and use those to make neurotransmitters, those brain chemicals that regulate mood and anxiety disorders. If your body doesn't have enough of those neurotransmitters, it can't make them. It is reliant on many of them, many of the essential amino acids, reliant on dietary sources of those. So if it doesn't have that red Lego block, it can't make that thing, that neurotransmitter that it's trying to make. Protein also induces satiety, helps us to feel full. Okay, so bringing all these mechanisms together, as we talked about, the healthy diet is going to include more phytochemicals, vitamins and minerals, omega-3s, and fiber. And those are going to have a positive impact on things like inflammation, gut microbiome, tryptophan, metabolism, as well as others that we didn't quite get into, things like the epigenetic changes, how our genes are expressed, oxidative stress, and mitochondrial dysfunction. All right, so the last little topic that I'm going to cover for today is implementation. So we know a lot about healthy eating, but making it happen is actually really hard. The hardest part in our research was behavior change is really difficult. Humans are creatures of habit. How do we support people in making changes to their habits on a daily basis? So I want to give you some resources that I think are really helpful. Again, I'm Canadian, so this is the new Canadian Food Guide. They actually developed a really, really awesome guide that has quite a lot of great recipes that you can explore, you can share with your patients if you're a naturopathic doctor. Also, this is the university that I'm affiliated with, the Guelph Family Health Study, made a series of cookbooks that are available for free online and have great resources. So one of the barriers that we encounter when we're talking about diet change, particularly among people who experience mood and anxiety disorders, one of them is motivation. So we developed some strategies that we used in our study to help people to overcome this barrier. One of them is goal setting. And I want to emphasize that we encourage people to focus on what they wanted to eat more of. We didn't set a lot of goals about eliminating things or avoiding things or reducing. We focused on what we want people to eat more of. So eating more vegetables, more nuts, more legumes, more fish, more complex carbs, and trying to focus on those things that they wanted to include. When we set goals related to avoiding or excluding things, people can feel deprived. And then when they do eat those things, they can feel really discouraged. So setting goals related on things we want to do. We also tried to stack the deck in our favor. So how can we set people up for success? For some people, that means making sure those ingredients that they want to use are really available, really accessible, really visible to them in their day. Things like preparation, getting people to pre-chop vegetables when they bring them home from the grocery store so that it's really easy for them to grab them and go as a snack. Or bulk preparing vegetables that they can heat up and add to their dinner. We also encourage people to think about when their motivation is highest. An example from the EASE-GAD study, there was a participant who really wanted to make overnight oats in the evening. But she found that at 8 p.m., she was just so exhausted from the day. It was so hard to get off the couch and do that. Well, I spent some time talking with her, and we realized that around dinner time or preparing for dinner, her motivation was really high. Around 5 o'clock, she was really keen to make dinner. So we got her to make her overnight oats at that time. So thinking about when in the day motivation is high and capitalizing on that, using that to accomplish the things that you want to do. Also, I would encourage you, if you're trying to make any changes to your diet or health behaviors, connect with a health professional for guidance and accountability. Another barrier that we recognize among people with mood and anxiety disorders is non-hunger eating. So people sometimes call this like emotional eating or eating in response to certain emotions. This is very common. It's common among our population more generally. So what we did is encourage people to recognize the reason for eating. When they were craving food, pausing, taking a moment and identifying, what am I feeling right now? What's that emotion that's present? Am I feeling bored or irritated or anxious? And what's driving that desire to eat? And then developing a plan for managing non-hunger cravings, helping people to develop some tools or activities that they could plan to do in response to feeling that way. We also taught people mindful eating techniques, like the raise and exercise, as a tool for increasing awareness of our eating experience. Okay, so in conclusion, mood and anxiety disorders are common. Not everyone benefits from the available treatment options. We know that diet quality is a risk factor for the development of these conditions, and diet counseling can provide significant benefit for individuals with depression. There is now also emerging evidence that this is also the case with anxiety, that dietary modification seems to also be helpful for improving generalized anxiety disorder. So I really want to thank you for your attention today. This is the reference to the EASE-GAD study, if you'd like to read it in a little bit more detail. And I'll turn it back over to Dr. Yanez.
Thank you so very much. So before we go on to Q&A, just wanted to give a quick update on our next upcoming webinar in January. Shortly after the holidays, we'll be talking about career changers with Dr. Greg Jones, who went from being a nuclear scientist in the military to a naturopathic doctor. And so very excited to have Dr. Jones with us for that next event, and we will have our upcoming events for 2025 also through the end of the year listed shortly. So thanks again. So with that, let's take some questions. You can minimize this or stop sharing if you'd like. So the first question, Dr. Aucoin, first off, thank you very much. This is from Dr. Weinhold. Thank you for the webinar. She wanted to know your thoughts about dairy worsening anxiety, and she's seen dairy casein to be specific sometimes make anxiety and OCD worse. Do you have any thoughts on that?
Yeah, I think there's actually a couple of studies that are taking place right now in Australia that are looking at different types of dairy, particularly like the A2, A1 forms that have different compositions, particularly I think in regards to casein. And I think that study is underway. So I think that I don't know the answer to your question. I think that research is in progress, but something that I'm glad some people are looking into. In my clinical practice, I think when I started practicing, I did a little bit more work with food sensitivities and exploring those with patients to see if that was beneficial. I actually wrote another case report about a patient with major depressive disorder who found some improvement in response to doing an elimination diet and eliminating some foods that she seemed to be sensitive to. Although I would say more recently in my practice, I focus a little bit more on encouraging people to add health promoting foods and a little bit less on restricting. We want to make sure that we're not encouraging things like restrictive eating. So my practice has sort of moved a little bit away from that. But I think when you're talking about very treatment resistant cases of things like OCD, then trying something like a more restrictive diet certainly has there's reason to give that a shot.
Thank you. And there was also mention of a high dose EPA supplement. Do you have any additional detail on that in the study? And did it have DHA as well?
It did have DHA, but it was highly in the ratio of EPA to DHA was quite high. And we don't have as much research about the relationship between omega-3s and anxiety. That area, again, same with the dietary modification, the omega-3 and anxiety area is much less researched. So we really looked to the omega-3 and depression research for guidance. And we have quite big meta-analyses that look at the relationship between omega-3 supplementation and depression outcomes. And from those, we know that having a high EPA formula, at least 60% EPA, seems to be most helpful for depression. So in the absence of really knowing for anxiety, we relied on that evidence.
Thank you so much. So there is a question here on nutrigenomics and nutrigenetic influence on some of these dietary behaviors and habits. Are you familiar with how that plays a role?
It's not an area that I'm an expert in. And I think there's, again, probably still a lot of research that needs to be done to fully understand these, but very likely an up and coming area.
Thank you. Do you have any resources for folks? I know you mentioned quite a bit on the Mediterranean diet. Are there any resources that you like to send folks to that are trying to learn more about that?
Yep. So the two that I mentioned, and I can put those in the chat in a moment. So one is the Canadian Food Guide, has quite a large collection of Mediterranean diet-friendly recipes, and the website's very user-friendly. You can put in lots of different variables like less than 30 minutes, or uses vegetarian ingredients, or kid-friendly, or uses apples, whatever you've got kicking around, and it's quite helpful for generating recipe ideas. The other one, the Guelph Family Health Study, as I mentioned, they have some free cookbooks as well. And then for our study, again, I can put this one in the chat too. We have a website, ccnm.edu/anxiety, and that has the recipe collection that we developed for this trial.
So I recognize there are some questions about the brand. Because of our conflicts of interest, we are not able to provide brands and dosages, but feel free to reach out directly to Dr. Aucoin on that. So I think that is wrapping up most of our questions here. There are a couple that probably don't relate to specifically to this, but feel free to reach out to us at info@aanmc.org. But Dr. Aucoin, I want to thank you so much for taking time today to share your recent research with our audience. And this has been really informative. There's so much more that needs to be done, but my a heartfelt thanks to you and the other researchers who are helping to further the research literacy of our community, to help build the database and really restore the evidence-informed practice within our community. So thank you so very much for being here today. And thank you to you all who have joined us. I hope to see you at a future AANMC event. Thanks for coming.
Thank you.